So I'd love to welcome Lisa. She's a long-term patient. How many years have you been seeing me now?
Over 20 years.
Over 20 years. I've been in practice a little bit over 30, so the majority of my practice have been. I asked Lisa to come in. She's been a terrific patient, and she has just a great story of hope. And so I'm going to just hand it over to you, Lisa, and just if you can go back in time and go back and like when you first started seeing problems, and just take it from there.
Well, I think I was probably seeing problems in my mid to late 30s, but I wasn't treated correctly. I was treated just with the basic antidepressants, initially with Prozac, and then with Zoloft, and I was still quite crazy. I wasn't being treated for the bipolar condition, and I was living in Ventura County with a doctor, and he, just offhandedly, I ended up with this doctor, and he diagnosed me as bipolar. And I was shocked at that diagnosis because I immediately, went into a shame spiral because I thought being bipolar was just so extreme. My idea of being bipolar was just being way out there and super crazy, which I was. And he immediately started me on different mood stabilizers, and none of which really helped me at the time.
What did you take? Do you remember?
I think he started me probably on, I don't really remember quite at that time. I don't think he started me on lithium or Depakote, but he started me on something like that. And
Risperidone, probably something a while ago. One of the more more beginning ones. But before that, just sorry to interrupt. But the Prozac Zoloft, did that make you feel worse? Or what did it do?
I guess it elevated my mood, but I didn't. I wasn't getting any relief from my major symptoms, which were, high anxiety and a high irritability. Mm-hmm. At that time, I wasn't suffering from my major problem with the mania, which was my inability to sleep and maintain any calmness or peace of mind. That came more into my 40s, and I think by the time I had begun seeing you, many doctors that I had seen had tried me on lithium lithobid, Depakote, and I had an allergy to lithium and lithobid, and then the Depakote was okay with me, but it had the side effect of the weight gain and just the bloatedness, and and then the lethargy and lack of motivation. And it wasn't until I got with Dr. Corona that I started to be treated with some of the more up and coming medications and mood stabilizers that worked better for me. And Dr. Corona put me on Geodon and Topramate, and I guess I'm on Geodon, Topramate, and Seroquel. My big problem was I couldn't sleep at all at night, at all. My mania affects me that way, where I have a tremendous difficulty sleeping. I could just stay up for days at a time, and I have, obsessive compulsive thinking, and just, the hamster, wheel of the head, and I would have the running thoughts and so on and so forth. But once we started me on that cocktail and started balancing the medications out of the Geodon and the Seroquel. The Seroquel made the biggest difference. because I began to sleep. And I started out on a very low dose of 25 milligrams and then 50 milligrams. And then I went through a period, I think there was a high stress period in my life where I had a tremendous amount of anxiety, and I had to start really increasing the dose. At one period, there was one day in particular, one week in particular, where I had a tremendous amount of anxiety, and you told me to just continue increasing the dose. And I think I actually went up to 300 milligrams of Seroquel, and I've stayed there, and that has been a good dose for me. So I take that at night along with 400 milligrams of topramate and between 100 and 120 milligrams of Geodon. And those are really stabilizing factors for me. And I feel like I'm very calm. And that has been life-changing for me. I went from being extremely suicidal with the onset of my bipolar condition. I was extremely suicidal and unstable. I've always been able to manage to hold down a job and maintain a sense of normalcy in my life. I have always functioned with a high amount of structure. And because of the balance of my medications, I have always maintained a really high structured, high functioning life. And I think that's what the importance is of these this cocktail of medications is it's really important for me to feel like I can participate in life as a normal human being and to be able to work. I recently widowed, but I was married for 22 years. I had a successful marriage, and I've had a successful career for many years, and it was really important for me to feel like I could participate in life on life's terms to the fullest and have a complete and fulfilling life. And I feel because of the relationship I've had with Dr. Corona and the way he's prescribed my medication and the cocktail that I have, I've been able to do that. And I am no longer suicidal a day at a time. You know, I was very suicidal for many years, and barely functioning, and barely participating in life, and having a lot of social anxiety, and it was very hard for me to function fully on a day-to-day basis, and I think because of the way Dr. Corona has worked with me over the many years, and it has taken many years of us working together with these medications, adding and subtracting at different times, depending upon my needs, that I've had great success with this, and I'm happy to share that because I think it's very important. It's a very hard disease to deal with. It can be very painful and very uncomfortable. And I feel I've had great success with Dr. Corona, and I'm happy to share that because it can be very uncomfortable to live with this disease a day at a time and not feel like you're able to gain any traction.
So the mania really started in your 40s then?
And I would say around 40, 41, 42.
Yeah, I know very common is what you're saying. It's the only diagnosis in psychiatry which really has severe insomnia. That's one of the things. I mean, you can have insomnia when you have anxiety and depression. But it's not as bad because with the thing with bipolar disorder, you can't shut your brain down. It just keeps going and going, and you lay there in the dark, and it can't stop, and you have to. So the Seroquel is just shutting that down and allowing you to actually sleep. And in your case, also you have your own Wellbutrin, which is So as far as the antidepressants with bipolar, we got to be careful because certain antidepressants, some of the common ones like the Prozac, the Zoloft, the Lexapros, even the Effexors, some Prestique, some of them will actually make it worse. And some of the antidepressants can cause mania. But Wellbutrin is unique because it's the only antidepressant that really focuses on dopamine. And in your case, dopamine is a major factor because Wellbutrin, Geodon, and Seroquel all work on dopamine. The Geodon and Seroquel help to kind of slow it down, so it slows your brain down. But if you slow it down too much, you're going to be tired all day. But Wellbutrin, we got to that gets dopamine moving so you can actually function. So that's why it's a it's a turn on and shut off valve to manage dopamine. And I think with you too, sometimes we up the Wellbutrin dose a little bit when you get into a depressive state.
Yeah. So I play with that a little bit. I forgot to add in that I do take the 300 milligrams of Wellbutrin every morning.
Yeah. And with us, we like with Geodon, when we go up, down a little bit, again, we got to be flexible with medication because you're a person, and a person's not a robot. You're changed, so your needs change.
Right.
Certain seasons, things can change. Holiday season, things can change, definitely. Spring, so things change, and that's why sometimes we have to adjust things. Going back, you mentioned starting in your 30s. Go back earlier than that. How about childhood, teenage years, 20s? Did you see any hint of anything going on back then?
Yeah, as a child, I was always very depressed, and I was.
At what age did you feel that?
I felt that as early as preteen.
Elementary school?
Yeah, at 12, 13 years old, I'm a recovering alcoholic, and my drug addiction and alcoholism started when I was 12 and 13 years old. I started using drugs and alcohol to self-medicate.
What drugs?
With drugs. And
which drugs?
I was using a tremendous amount of uppers like cocaine, dexedrine, speed. Some pot, some psychedelics, but mostly dexedrine, cocaine, and a lot of alcohol. And self-medicating with that a lot. I used copious amounts of speed and cocaine and a lot of alcohol, and ended up in treatment at 16.
Okay.
Getting sober at 16. Yeah.
Okay, good. Wow, that's the early age to get sober. You've been sober since 16?
Yes.
Wow.
Yeah, 49 years.
Sheesh.
Yeah.
You still go to any kind of a program?
Yes.
Or you do? Wow.
Yeah. I still go to AA. Yeah.
Wow. So have you sponsored people?
Yes.
That's great. That's amazing.
Yeah.
So from 16 to 30, so things were doing pretty well during those years then?
Well, I think that I was involved in obsessive compulsive behaviors. I can see how the mania acts itself out in different obsessive compulsive behaviors. Overeating, over shopping, romantic relationships, obsessive compulsive behaviors. I can see how the mania wants to act itself out if I'm not balanced. You know what I mean?
Yep.
I don't know if that is part of the mania of the bipolar condition. If it's not balanced.
It's all part. Yeah, it starts usually before 30s. It's probably the 30s is when you started getting the mania to the point where you couldn't sleep well.
Right.
But before that, that's when that's what gets people to treatment. Because you can only handle severe insomnia for so long.
Right.
And the problem is traditional sleeping products don't work.
No.
And so when sleeping, and again, with sleeping medication, we got to make sure that, just really get to the core of why is the person not sleeping, not just throwing a sleeping pill. I call a Band-Aid approach to medication, just throw a Band-Aid at the problem. And you want to really, focus on, okay, why, there's always a reason why someone has something. And a lot of doctors just slap something on without really diagnosing and saying, take some Ambien, that should help. And like,
right.
It can, but again, with bipolar, even that doesn't help.
Ambien does not work for me. Ambien does not work
Right.
for me in my condition.
Right.
It does not even affect
Right.
the sleeplessness. It does not work on my my system.
Right.
They will not touch it.
Yeah.
It's not strong enough.
And then so between then and then, but like I said, when you were in the early 30s, when you started really seeing like the sleep issue.
I didn't have a problem so much in my 30s. I think
40s.
It started more in in my 40s. I really think so. It really started more in my 40s. In my maybe 38 to 42 is when I started.
It's not uncommon.
Really?
Not uncommon at all.
And I don't know if it was. I think what could have triggered some of the mania or exacerbated it was going on the Prozac and the Zoloft at higher doses. I think it sort of was like had a kindling effect.
Exactly what happens. Yeah, the wrong antidepressant. If you don't make the diagnosis and take it, doctors. It's all about, in this area of medicine, it's all about history. So people say, how do you diagnose? You diagnose by listening to people, asking questions. We don't have blood tests. We don't have scans. We don't have some of the traditional ways. People say, well, can you do a blood test and check my serotonin and dopamine levels? I go, no, it doesn't work that way. If I did a spinal tap and took out some spinal fluid, say, oh, can't you look at the spinal fluid? I go, even that's not going to help because it's not showing what's happening at the neurons level. Because what's happening is at the cellular level of the nervous system, and there's no test for that. So the test is actually the treatment. So when I tell people, look, I draw the diagram. I'm sure I've had that with you. I draw the diagrams of what I'm doing. And I explain, look, if I'm not right about this is not going to work for you. If I'm right, however, it will. So the test is the treatment. It's the only thing in medicine where the test is the treatment is actually the test itself.
Yes.
But people have a hard time with that because they go, well, I want a test that's going to tell me if I should take. I said, I don't have that, and I can't provide you that. I said, I have a good idea what you have, and you have to take a good history, all the details, and you gotta go back in time because I think doctors look at the now, and I think doctors look at the here and now, like, oh, you feel depressed, here's an antidepressant. Oh, you feel this, take this, and they go back and say, well, let's go back to the beginning when this started. With your history as a teenager, with you gotta go look at all that, and again, when you feel like, and very common, the onset of depression is early teen years, late elementary school, middle school, early high school.
Very depressed. Yes.
Yeah, and that's because of the hormonal puberty kicks in, and that's what sets that off. But I think the difference is, if it's a regular, we call unipolar depression or anxiety. Antidepressants work great. They work wonderfully. And when they don't, we got to sit back and go, okay, wait a minute here. Don't keep throwing antidepressants at this. This is something different, and that's why I started thinking about mood stabilizers, and taking. Now, it became more apparent and obvious, obviously, when you're in your 40s, because when you have that bad a time with sleep, and when you have suicidal ideation, that's a signal that there's something more going on.
Right.
Most of the suicides and ideation is with bipolar. Take Robin Williams. Robin Williams' a death that really affected me. He's you think he's the funny guy. He's the guy that's always making people laugh, right? He seems so happy all the time. Why would he kill himself? Makes no sense. But you think about him, he had, rumors is that he did a lot of cocaine. And, if you know Robin Williams, he's just always super hyper and constantly, his mind is constantly going. Well, he was bipolar. And at the end, I think that really never came out. They said that he was having some kind of early dementia, which could have been. But what leads to suicide is bipolar, and if it's untreated, rarely depression, anxiety without the bipolar can lead to suicide, but it's not common at all. And it's the up and down, and it's the mania, the depression that follows, and that kind of roller coaster is what leads people into the hopelessness. And suicide is just one of those things that it's a thought, and some people just act on it right away without thinking about it.
Right.
Thankfully, you didn't, and you dealt with it for a long time.
Right.
How did you deal with that? And was there ever at the point where you were planning it?
I realized that after dealing with the ups and the downs and the depression, that I had the presence of mind to realize that what I was going through was chemical, and that it was an ideation, that it was an idea that was swimming around in my mind, and that it would pass, that it wasn't necessarily a good idea, and that when I got my medication correct, it would go away. I was being treated and medication wasn't working for whatever reason, whatever doctor I was with. And that it was a side effect of my bipolar condition. And I'm a pretty practical or reasonable person. So I realized that it was a side effect of my bipolar condition, and that I wasn't going to do it, and that eventually that this would pass. And so I would just continue on with my life and be normal and do normal things, and that once I got my medication correct, I knew it would go away, and that I wasn't going to act on it because it was ridiculous. That's just who I am as a person. I wasn't gonna act on it, and I knew that my medication was off, and that this was a side effect of that, and that I was miserable and I needed help. So I did not have a good doctor at the time. I needed to get that right. So I knew that I was feeling that way because I was bipolar, not because it was the right thing to do. Does that make sense?
Totally. And it's one point also to make clear here. People get very confused because when you look online, people think, oh, antidepressants increased risk of suicide. When that first came out, I was so angry. This was like, I don't know, maybe 20 years ago, but it made me so angry because I thought this is not a good thing, a message to put out there. The FDA, the government starts to slap the suicide warning on antidepressants. And the reason for that is because it's not depression. If you take an antidepressant and you feel suicidal, you're bipolar. You're not depressed. Well, you might have depression or bipolar or depressed, but you're bipolar. So it's a misdiagnosis. And so, but that message never came out. And now they slap that label on even mood stabilizers. If you look at on TV commercials, Vraylar, Rexulti are the two new ones, Capilite you're going to see. There's a few of them that are name brand that are being advertised. You're going to see and antidepressants have suicidal ideation, and it's like these aren't even antidepressants.
No.
But they label them and they slap this antidepressant on everything. And if someone's watching a TV commercial and they hear that like, why would I take that if that's going to cause me to go to suicide? Why would I?
Right.
And that very problem. And I predict I wrote an editorial to send to the paper, an angry editorial about how irresponsible this was to put that out. And I don't know if it ever got printed because I think I was probably ranting a little bit on there. But I knew that this would cause damage, and I knew that this was sending a really bad message out there. And this is the problem with getting information from the internet. The internet's a very, very bad source of information. And family and friends is a really bad source of information. Oh, my friend said this.
Sure.
And so what happened is, people use that as, well, I don't want to go on antidepressant, look, if it causes suicidal ideation. But see, suicide, it almost always bipolar. It could be bipolar depression. It may not be bipolar 1 with mania. It might be bipolar depression, which doesn't have any mania. It just has really bad depression. That's the only thing they have. So some people with bipolar have none of that, and they have no problem with sleep. They get severely depressed, and the way of diagnosing it is the antidepressants just aren't working, and then you put them on mood stabilizers, and they work. And now it's also really, and what this led to is now they put that warning on everything, like things like Geodon and Seroquel you're on, but there's new ones that are out, Vraylar, Rexulti, Caplyta, and some of the newer ones on the commercials on TV, you hear the commercial, and you see all these nice pictures and people are running around and playing, and then you hear all these like 5-minute litany of negatives, and then it may cause suicidal ideation. It's like, no, this is a mood stabilizer. It does not increase suicidal ideation. But they even say, well, antidepressants will cause, and I go, it's not an antidepressant. Every time I see a commercial like that, it just gets to me because I can't stand it.
I don't think it's the medication that caused that with me, that caused me to feel suicidal.
Right, it wasn't with you.
No,
right.
I don't think that caused it at all. I think it was my bipolar condition and not being. I don't think I was. My medication was correct overall.
Right.
Whatever had been prescribed for me was not covering it. It wasn't.
Right.
I wasn't being treated.
Well, the suicidal ideation comes from not being treated.
Right. It was. I was basically untreated or not being treated sufficiently. I wasn't being given enough medication or enough mood stabilizer. Or too much antidepressant and not enough mood stabilizer, or not the right kind, and I just realized that it's just insidious. It's just a side effect.
Yeah.
The suicidal ideation is just a side effect of the bipolar condition. It just erupts. It appears.
Right.
Whether you were thinking of it one day or not, all of a sudden you feel suicidal.
And some people, it's just such an impulse. They think it, they act. Another, I mentioned Robin Williams. Another one, if people know, I don't know if you know Twitch. Have you heard of Twitch? So Twitch is a very popular dancer. He was on the show So You Think You Can Dance. He was on Ellen DeGeneres' show when she had one. But here's the guy dancing, smiling, happy. And one evening he had a wife and 2 young kids, and one evening he left, and he just walked out of the home, and his wife eventually called the police because this is not like him. He didn't bring his car. And he ended up going to a hotel and checking into a hotel and hanging himself in the hotel room. And people just like, doesn't make any sense.
Yeah.
This makes no sense. And people, people with, and again, suicide is obviously the worst outcome of mental health. There's no reversing that. So people, get confused by that because, Robin Williams, Twitch, and a lot of people, super successful, have everything you would want in life, rich, everything, famous. And people are like, well, why would that person have anxiety? Why would that person be depressed? Why would that person feel suicidal? They have everything. I hope you enjoyed the show today. If you have issues with mental health, or if you know someone who needs help, I'm available. If you want to contact my office, my website is drpaulcoronamd.com. That's DR for doctor. And you can also learn more about me on my website. My phone number, if you want to contact my office directly, is 949-481-0118. If you want to learn more about my methods and what I do, my latest book, I recommend The Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide, 30 years in the making. In this book, I tell 30 original short stories about people. And I also have my first 3 books, Healing the Mind and Body, the trilogy, available online. I look forward to you joining me again on the next episode of the Dr. Paul Show.